Hi, so it's like what I don't even know what time it is. 3 o'clock on Thursday. I don't even know what day it is. My brain's fried. Thursday, March 19th, 2020. So I am currently working from home. We are doing split shifts at work. We're doing a first shift and a second shift. We are cleaning in between the shifts. I have seen I was actually fairly busy today, but I did recommend a few patients that came in today that they should probably stay home, and I made sure that they had home exercise program. I am a senior therapist in my company, so I am helping out the clinical director and our administrative director, the owner of the company. So not only am I seeing patients and signing PTA notes and signing newer grad notes, I'm also doing research and reading articles, making sure that we're getting set up for telehealth, making sure that what they're seeing and what I'm seeing, that we're on the same page. I'm going to try to watch the APTA's webinar tonight, and then I'm also going to try to watch their Facebook Live feed tomorrow. We have to make sure that we can do telehealth in a private area and also an area that doesn't have like your kid screaming in the background, or your husband making lunch or watching TV or stuff like that. So I literally had to set up a little makeshift desk in our basement because I don't have any other way to do it. So yeah, it's definitely different times. I went through my patient list and made sure that patients that weren't appropriate to come to therapy wouldn't come. I had somebody who was on my schedule who is we call them repeat offenders. So somebody who's, like a patient that you see multiple times a year, who has a very significant medical history and compromised lungs. And I had to tell them I did not want them to come in, that we would try to reschedule their appointment for later. And they were upset and they wanted their order, but I'm not having their life lost just because I wanted a visit. So definitely having to make some ethical choices, but tough choices, because we're losing revenue. Everyone's losing revenue. So this is tough. So, being a physical therapist, I'm in the healthcare field, but I'm not on the front line like the doctors or nurses, and I can only imagine what they are all going through. I'm glad I'm not in their shoes, but I really feel for them, and I know my stress level is like a 10, so I'm sure they're probably running at full capacity on anxiety, caffeine, junk food, whatever they can do to get them through this. So make sure that you are taking care of yourself, make sure that you're looking out for patients, and just be kind to each other. Don't hoard all the toilet paper. Um, and just, really do what you can to minimize your risk of exposure and the risk of exposure to your family members, especially if you have older family members, although they're finding that even millennials, which I don't like to identify in that group because I'm 33 and I work with a bunch of younger millennials, but technically I'm a millennial, so they're finding that we can be affected just as much as older populations, but obviously the older population is more at risk. So just take care and do your due diligence and do your homework when it comes to this COVID-19 telehealth, keeping your clinic open, seeing patients, CDC recommendations for cleaning, all that stuff. So take care, stay safe, stay well.